Selecting the right peripheral IV catheter is essential in achieving positive patient outcomes with IV therapy. Protection of healthcare workers from blood and the pathogens it might contain is paramount. The short peripheral IV catheter should be evaluated on a variety of attributes rather than a single one. Things to consider are how the needle is shielded, protection from exposure to blood, visualization of blood return, also known as flashback, catheter material, and stabilization. Let's explore each of these individually. The evidence-based infusion nursing standards of practice states a short peripheral catheter equipped with a passive or active safety mechanism should be used to provide Sharp's injury protection. A recently published study indicates that devices with automatic or semi-automatic safety features are 10 times less likely to be associated with a needle stick injury. Another consideration should be the robustness of the needle shielding mechanism. Does it completely shield the needle or just a portion of it? Can the needle become easily re-exposed once shielded? Is there any clinical evidence specific to the peripheral IV catheters under consideration? Does the peripheral IV catheter incorporate any features that keep blood from leaking out when the needle is removed? There are catheters that accomplish this by having the extension already incorporated into the catheter, or with a septum in the catheter hub that keeps blood from coming out. Be aware that blood exposure can also come from other parts of the device, such as the needle shaft or safety mechanism. Be sure to thoroughly evaluate the potential for this type of exposure. Getting into the vessel can be one of the toughest things about placing an IV catheter. Technology that provides you with visual confirmation of placement in the vessel is paramount to success. Is blood immediately visible along the shaft of the catheter once the vessel is penetrated, or do you have to wait for it to appear back in the flash chamber? Consider additional confirmation features, such as the continuous flow of blood along the pre-attached extension of a closed IV catheter system. Once the catheter is in place, the hard part is over. Now we have to keep it in place. The Infusion Nursing Standards of Practice and the Centers for Disease Control Guidelines for the Prevention of Intravascular Catheter-Related Infections both recommend the use of stabilization devices to minimize catheter movement and decrease the risk of complications. A device can be attached to the IV catheter once placed, or a newer option where the stabilization is built right into the IV catheter. Both options have been shown to have similar outcomes. The material the catheter is made out of is another consideration. Most short peripheral IV catheters are made of FEP polymer, polyurethane, or Vialon. Ask if evidence linking the specific catheter material to patient outcomes is available. Looking at the clinical evidence can be tricky. Take time to understand how robust the data is and how it compares between the catheters. For example, does one catheter have a white paper on needle's sharpness while the other has a randomized controlled study? Choosing the right peripheral IV catheter can benefit you as well as your patient when you consider a variety of catheter attributes. You should not only be protected from a potential needle stick injury, but also from exposure to blood. Other catheter attributes that enhance your ability to successfully place the catheter and improve the likelihood of it remaining in place should also be considered. And don't forget to compare the clinical evidence supporting the specific catheter features.